Good afternoon, everybody. Welcome to Monday, March 8th, 4:30 council meeting. And before I call the meeting to order, I would just like to make an announcement that next week is a committee of the whole meeting, but there will be a special council meeting at that meeting to discuss and approve the 2021 operating budget. So just please note that. I would like to just make a couple opening remarks. First off, I would like to thank St. Anthony's School. They had, the grade 6 classes had a panel discussing local government, and Councillor Garbutt and Councillor Zariski attended with me, and we were tossed some pretty interesting questions, and it was really quite neat how they were quite inquisitive. So thank you both for joining me at that and helping the kids out. And one of the questions they asked us is what should be, or what is the biggest fine for in our bylaws? And of course, I had to give my own opinion. And I said the biggest fine should be for littering, because I was out this morning walking with my daughter, and we picked up 2 bags of garbage. So in saying that, I encourage everybody, the listening public, if you're going out for walks, the weather's nice, please take a bag with you, help clean up our community. As well, I would like to acknowledge that today is International Women's Day, and congratulations to all the women and everything they do. And I would just like to celebrate every woman who has been employed by our organization, who helps us achieve amazing things in our community. Currently in the town of Drumheller, we have 53 female employees in our organization and 3 female elected officials in our council, who all work hard to make the valley a better place for everyone. To learn more about International Women's Day in Drumheller, please visit our official Facebook page, Twitter, Instagram, and other things that different people are sharing, and join us all in celebrating International Women's Day. And today we put great honor to Dorothy Burgess, who was one of the past councillors within the town of Drumheller, and you can read on our Facebook page and all of our social media some information about her. It's a great story. So thank you to Sharon and Grant for allowing us to do that. So now I would like to swear in Councillor Fred Makowecki for the months of March and April. And although Tom and I didn't get a lot to do, things to do together, but thank you for helping where you could, so appreciate it. So Fred, we do not have the ability to hold the Bible, so I'm going to trust that you are going to read this and follow it through. So could you please read it?
Sure. I, Fred Makowecki, swear that I will diligently, faithfully, and to the best of my ability, execute according to the law the office of Deputy Mayor for the town of Drumheller for the months of March and April 2021, so help me God.
Congratulations, Fred.
Thank you.
Okay, now I will move, and can I ask to have the agenda for March 8th adopted, please? A motion, Fred, seconder, Tom. Comments, any additions, deletions? All in favor? Carried. Attached, you'll find the minutes of February 22nd, 2021 regular council meeting. Can I have a motion, please? Tony, seconder. Christine, comments? All in favor? Carried. And you'll also find the Municipal Planning Commission meetings of January 14th. Could I have a motion on them, please? Tom, seconder. Fred, comments? All in favor? Carried. And now we'll move on to 5.1.1, and Daryl, I'll let you take over from here, please.
Thank you very much, Your Worship. So this is a motion for council to consider to support a national 988 crisis hotline. So this came to us through our local MP, Damien Kirk, who was, and basically on December 11, 2020, the House of Commons passed a motion introduced by Conservative MP Todd Doherty through unanimous consent to bring a national 3-digit suicide prevention hotline to Canada. And that given the alarming rate of suicide in Canada constitutes a national health crisis, the House call on the government to take immediate action in collaboration with our provinces to establish a national suicide prevention hotline that consolidates all suicide crises numbers into one easy to remember 3-digit 988 hotline that is accessible to all Canadians. And so what Damien Kirk is asking for is that our council, as well as all the councils in the Battle River Crowfoot area, consider passing a motion in order to make 988 a reality. So there is a motion in there if someone cares to read it and pass it. So
Can I get a motion, please? Jay?
Thank you, Your Worship. Whereas the federal government has passed a motion to adopt 988, a national 3-digit suicide and crisis hotline, and whereas the ongoing COVID-19 pandemic has increased the demand for suicide prevention services by 200%, and whereas existing suicide prevention hotlines require the user to remember a 10-digit number and go through directories or be placed on hold, and whereas in 2022, the United States will have in place a national 988 crisis hotline, and whereas Drumheller Council recognizes that it is a significant and important initiative to ensure critical barriers are removed to those in a crisis and seeking help. Now, therefore, be it resolved that Drumheller Council endorses this 988 crisis line initiative, and that staff be directed to send a letter indicating such support to the local MP, MLA, Federal Minister of Health, the CRTC, and local area municipalities to indicate our support.
Thank you. Can I get a seconder, please? Christine? Comments, please. Go ahead, Tom.
Yeah, I was just going to say that this is a long time coming. There are places that have had this for a number of years. It's very effective and absolutely a given.
Jay, go ahead.
Thank you, Your Worship. Yeah, I too am pleased to see Canada look to progress in this area. Little known fact is I spent 10 years in Edmonton helping to coordinate a suicide prevention and crisis hotline. And while I don't particularly agree with two facets of the motion, the mention of what the United States is doing is superfluous. And I'm not sure it's factually accurate about the other line that people have to memorize a 10-digit number and have to go through directories, etc. Given the one I worked with had the most common prefix in Edmonton and spelled out help at the end. I'm not sure I agree with all that was in the motion, but at the same time, if you take out those two elements, what we're wound up with is a national approach to what is a national health crisis that is often completely ignored. And prior to COVID, is the second leading cause of death for adults between ages 40 and 18, and needs to be addressed on a national scale. So I'm fully in favor of this. I'm certain that the request for support is because the provinces will be required to step up with additional funding. I'm curious to see how this is laid out, but the province-wide information numbers, like 211, et cetera, have had their issues with rollout, but nonetheless, I think that giving access to all Canadians to something like this in their time of need will be a very important step forward.
Perfect. Anybody else? Fred, go ahead.
I echo what you said, Jay. It's a long, and Tom, it's a long time coming. And I have over the past couple of years have said more than once, you're not going to hurt yourself, are you? So it's really welcome, and I sure hope it'll be used by the people that really need it. I wholeheartedly support this.
All right, anybody else? Okay, so all in favor? Carried. And Denise, I will leave this with you to send the information to all the people required on the list. So thanks so much. Okay, we will move now on to 5.1.2. Daryl, I'll let you take this one again.
Great, thank you, Your Worship. So this is a request for decision for bylaw 0321. So this is to adjust the size of an environmental reserve and extend a municipal reserve in the Hillsview subdivision. There's a bit of background on it, but basically, as in parts of our community, a lot of our community has front street and back alley areas, but parts of it are just front drive only. And so the south side of the Hillsview subdivision is such a place. When it was created, the lots were sized such that you could have a 6-meter setback from the front street or from the front property line. That was a requirement under the land use bylaw. And so the lots were a little bit shorter than normal. And so as the houses have been developed on that side of the street, basically every time they come in, they are requesting a variance. And then in 2016, there was a change made to the land use bylaw to basically move front yard setbacks with anyone with a front drive to 7.6 meters back. And that was effective or made in effect because people were parking their long vehicles in the driveway, like their crew cab, short box trucks. And what was happening was that the bumpers and trailer hitches were hanging over the sidewalks and causing people to walk onto the roadway. So the bylaw was changed to make that setback even further back. And that created a bunch of issues for those homes that were being built because they now essentially had no backyards. They were having to have variances on the backyard, so you couldn't put a deck or a patio in the backyard without getting a variance on it. And so that had been fine for those who come to MPC. Those have been all approved, those variances. But in this lot, this is the corner lot that's next to an ER. And with the angle of it, the house was already adjusted to take into account the side yard. And now just with the side and backyard, the variances are very tight and essentially leaving the property owner with almost little to no backyard or side yard. So we do have enough space in this area to be able to grant them a bit of a triangle piece of land to sell this to the developer, to be able to grant this property a bit more of a side and rear yard without negatively affecting the area around it. The area in question is flat land. There is a ditch behind the property, or swale that goes and drains some of the lands to the south and takes it through a land drainage system. So we're hoping to accomplish two things. One is to put this, have this triangle change from ER to neighborhood districts and then consolidated and sold to the developer. And the other is to create an MR that extends out to the street, because right now, under current circumstances, we are having to cross an ER every time we would need to go and access our MR. So this is basically a way to correct this, and this really should have been done in the first place, but here we are now. So looking for first reading of it. And I think in this case, if we have any questions, if we want to do it before first reading, because it's a request for decision, we can do that. But the motion is at the bottom there. So.
Okay, so does anybody have any questions before I go to first reading? Go ahead, Fred.
I would just say that I had an opportunity, muddy as it was, to pace off the wider section of this. It was less than 7 steps across. So just so people are aware, it isn't a huge amount of space at the back end and to the front. It tapers to the front. So and there's basically dirt there. Yeah, just thought I'd make that observation.
Okay, oh, go ahead, Tom.
I was just going to go for the reading.
Okay, can you take a motion, please, Tom?
No one else has questions? Good. Okay, I move that council moves first reading of bylaw 03.21 as presented and set a public hearing on this bylaw for 5:30 p.m. on Monday, March 22nd, 2021.
Seconder, please. Jay? All in favor? Carried. Okay, we will move on to Chief Resiliency and Flood Mitigation Officer Darwin, 5.2.1, a flood mitigation update, please.
Thank you, Your Worship, members of council. A few updates, 4 categories is the to discuss this evening. First and foremost, as we've worked through last fall and into this year, doing examination of the various embankments that create our diking, we discovered many locations from East Cooley to Knacmine and on both sides of the river, where people in the last 30, 40 years, it's been over quite a period of time, have maybe put their favorite fire pit or have even fenced off portions of the public land or have built buildings that straddle their property line onto the public land. Just want to use this as an occasion, and we'll do it a few other times in our comms. Those have to be removed. They were put there by the people. Some of them want to just abandon them in place and have us deal with it now. But anyways, they've got to go. And some of the signage, the posts that go into the fencing, etc., can compromise the dikes. So we got to be careful that we take them out appropriately and not have folks putting them back in. It's public right away. It's for a public purpose, and we got to make certain that people don't use it as their own private area. So the sheds, garages, fire pits, and fences will have to go. Trees. We've made a lot of progress on our tree program, and the word of the week, we'll see Morris use it in his rumors, I think, and maybe hear it in the Drumheller Mail, is senescent. And given the spirit of your conversations at school this week, maybe that's a word for the week of the flood program. And it means end of life for trees. As they approach that end of life, usually their root structure, the core of the tree, and many of the limbs start to fail. And certainly with the poplars that are very rapidly growing, but rapidly age and become senescent in Centennial Park, we've got a lot of cleaning up to do of those old trees to make it safe for everything from powwows to the actual physical build of the diking. So as a result, we'll be starting next week, removing a considerable number of trees in that area. But I'm happy to say that we've been able to work with our advisory team, and we'll be using a 5-to-1 ratio of replacement over time of trees so that we can begin to approach and exceed the carbon capture and oxygen generation that occurs amongst those trees that are there. So that's a big part of the tree inventory that we talked about last summer. We'll be continuing to work with the federal institution at the tree farm, and we'll be hopefully be in a position that some of the old tired boulevard trees maybe we can replace as part of this program in other areas of town, so that we can continue our sequestration and oxygen generation. With regard to item number 3, land, and again, this is just topics I'm hitting. There's no written approach to this. Land, we're getting inspections done. Our geotechnical teams are doing more intensive drilling this week and next. We've got our engineers on site along with our surveyors in many locations. And the land appraisers are starting to deploy to areas throughout the valley as we're able to make appointments with folks to do site visits and understand the value of the homes. Finally, last week, the provincial government announced that in regard to emergency management and disasters, that municipalities will now be required to fork over 10% of the cost of response and recovery. This is a significant departure from the last 30 years of how Alberta has dealt with disasters and communities, and could be of extreme significance to Drumheller. So the head of the disaster recovery program, Mr. Brad Geddes, and I had a detailed, lengthy conversation today to try and understand exactly what the motives are of the government and what the program will look like in future. Certainly the government wants to be out of the business of emergency management funding, and with that is looking to the federal government to pick up the lion's share, and any remnant would be on the backs of the taxpayers at large as the municipality. But most alarming is that they have a one and done policy now, wherein they will only pay to a maximum of $500,000 for a residence or business that gets impacted. Again, that's a significant departure from the past. When they say one and done, that means that that's it. Caveats go on the parcel, and there will not be additional funding in future if there's multiple events. So those that qualify for, or we have completed buyouts of their properties, thankfully we're ahead of the curve for some of those, and I'm hoping that the others will assess their situation and let us know if they're interested. Many, of course, have, and we'll want to do more work with them on that. Government also advised that the race is on to get to a federal, a national flood insurance program, similar to the other G7 countries, and that they will be fashioning it much along the line with the British model rather than the American model, which is probably of an advantage if we think that a flood insurance program is good in the first place. So we'll continue to work with them and try and translate a lot of the things that they're saying into language that is communicable to our community. But as we've been talking through last fall, and is a main aim of this program, we want to preserve the value of the homes by making certain that they are insurable and bankable. And that is a primary goal of our flood mitigation strategy, and make certain that we can stay one step ahead of the costs that could be attached to recovery and response. Your Worship, if there's any questions, be happy to try to entertain them. April 1st is when the new requirements of the 500,000 one and done and the 10% limit go into effect of this year. So it's
All right.
Thanks.
Thanks, Darwin. Jay, you want to go ahead?
Sorry, Jay, you're on mute.
You're on mute, Jay. Sorry.
Thanks for that. How about now?
I can hear you.
Excellent. I just want to return back, Darwin, the one and done change in the way that the provinces and that everyone is approaching disaster mitigation does or does not impact the formulas that we're using to run the programs we're currently running under the project? Yes or no?
No, it would not change the funding formula, but it will make us probably be more aggressive to ensure that people understand that they are in a one and done scenario wherein they haven't been to date, and as such, it may be in their best interest to proceed with buyout soon.
Right, and so I think that's a point that can't be emphasized enough. That with as many times as I've heard people question this project that we have taken all these risks to embark upon, to question its validity, this is just another example of where this project has been proven as forward thinking, and as you said, one step ahead of the different orders of government starting to turn their backs and walk away from the way things used to be done, where it doesn't matter how many times you got hit with whatever risk it was, somebody would always come to the table and help you out. Those days are ending. It is critically clear that we have understood this for some time now and have been trying to make sure that the public understands that message. This policy shift has just proven us right again that this project is imperative in this valley to protect the property and the persons and the economy, and we cannot restate it enough times that for those doubters out there who think that putting their heads in the sand and acting like everything will be okay because it was in the past versions of okay, those days are over, and we need to move forward, and that's exactly what we're doing, and that we're having tremendous success with most of the directly affected thus far. That's probably not being said often enough, that the doubting public probably isn't hearing often enough that the people who are directly affected by the plans that we've had to make are responding, are taking advantage of the programs. There are very few holdouts, and the biggest issue now is that we're just human. The team is only so big, and we can only get to so many people in such time. So again, we beg the community's patience in allowing the program to roll out the way it needs to. But again, this is simply just a check mark in the box that says, of course we needed to do this.
Yes, it certainly is a coincidence, a planned coincidence that January 15th, the province published its flood numbers as to volume and elevations, and now are announcing that they will no longer be participating in saving homes time and again. So yes, we need to accelerate our efforts to inform everyone and move forward with the program.
Thank you.
Now, Tom, you got questions?
Yeah, I noticed that there have been some vacancies in some of the properties. And I'm just wondering if you knew, or I don't know if you can answer this, where the people have relocated to, and have these people remained in Drumheller, I guess would be my important question.
Councillor Zawicki, I don't think if we were able to, I don't think we're allowed to track where people go in that regard. Anecdotally, I can advise that the people have displaced in the general Drumheller area. There is a couple that have moved far away, as I understand it, but I don't know the particulars of that. It's certainly in our interest to have those people stay in the area. And if and when we're able to get to the point where we can maybe tender some of the homes to be moved that we've had to buy out, maybe we can look at some semblance of incentive that tries to keep those people in and about the valley and certainly within the town limits itself. More detail to follow on that.
Christine, go ahead.
Thanks. So Darwin, have you at all heard whether this has sparked some conversations regarding insurance, or is that going to be the next thing to come down the pipe?
So that is next. Again, we've been tracking and you know, it's a cornerstone of our program to preserve the insurability of communities by making certain that there's protection measures in place. This will cause even us to move faster, so that's there. The federal government and the provincial governments and the territorial governments are all working with speed to create a national flood program, flood insurance program that people in the risk zones are going to have to pay premium on. So it's very important for us, for our protection zones, i.e. between the river and the 2100 system that are protected by dikes, to go beyond and make certain that our multi-barrier approach includes the backflow preventers, the sandbagging at homes, the knowledge and awareness at the homeowner level, so that we can demonstrate to the insurance companies that indeed the community and the particular homes are remaining insurable.
Great, thank you.
Anybody else? So Darwin, how do we get out that message that's like this one and done? Because I think, you know, just hearing that myself, I think people have to really be aware that, you know, this whole project is, I guess in hindsight, I guess it's almost like we had, you know, it's more than ever that this has got to be put into place. And how do we just really enforce with people that it's not about, we're trying to it's not about trails, it's about, you know, the main cause is to try and prevent the homes from being destroyed. And I think that's something, and I know you guys are really working on it through communications, and I guess it's just more and more for us to reinforce to people that it, you know, we seriously just are worried about their homes and their properties. And, you know, and I know the frustration is that they just assume that we're putting these up for trails. Well, that's not, you know, some areas might be used for that, but, you know, the reality is it says protect the homes. And what you've said today is just reinforced that we're doing the right thing.
Mm-hmm.
So,
Your Worship, I'm sure I'm going to get a call again from the province, probably taking umbrage with my description of one and done. They've got much more eloquent language that says that it's a capped recovery program and reinvestment strategy, et cetera, et cetera. But what it means is that they're just not going to be there in future. And we've certainly recognized that and tried to figure out a way to get in front of that. Again, I think Councillor Garbett said it well, that, you know, please have patience with us as we're trying to assemble the lands, because I do believe, and we've seen it start a little bit last fall, where the people that aren't directly beside the dike or have the dike running through their yard are getting pretty impatient when it comes to, they might not have an insurable home because their neighbor that lives on the river is holding out because maybe someday somebody might put a pathway on it. And we just got to make certain that we get enough information out that doesn't boil over into neighborhood revolt or argument. But it is wholly necessary that the people understand that we have to put the dikes between the river and the houses.
yeah, it's definitely, you know, we're doing this all for the right reasons. And I guess just for the listening public, I mean, from what I'm hearing out there, I mean, you're obviously going to have a certain amount that are not, you know, that don't want things, but the bulk of people you're getting support from, is that not true?
By far. There's very few that are very vocal or trying to stir up the neighborhood, and that will continue, I'm sure. But by and large, people are quietly, this has to happen, are in favor of it, and we'll continue to try and move ahead.
Okay, well, thank you for that. Anybody else got questions? Okay, Darwin, well, thank you so much for that. Let's move on to 5.3.1, Greg, and can we get an update on flood or on COVID, please?
Good afternoon, everyone. I watched the Minister Shandro's and Dr. Hinshaw's update at 4 o'clock. Minister Shandro, very positive. He believes we're completing step 2. As of today, they are easing retail from 15 to 25% of fire code capacity. They're expanding the sports and youth sports and collegiate activities to a maximum of 10 at a time, including coaches, trainers, and players, but they must institute physical distancing and mandatory mask wearing. They also mentioned about performances, child, youth, adult performances, singing, dancing, theater, wind instruments to a maximum of 10, but 3 meters of social distancing, but performances that do not allow spectators anywhere. Dr. Hinshaw remarked that the positivity rate is 5.4%. Our rate is 0.95 for the province. At present, there's 254 in hospital, 36 in ICU, and 6 more deaths today. The vaccine program, the AstraZeneca phase 2 starts on March 10th, starting with the year 1957, and they will progress that with birth years and dates to be announced while the supply lasts. The minister announced he thinks everybody can be vaccinated by the end of June. And I think that's about it. Locally, this afternoon, the numbers were updated to 45 on the AHS website for Drumheller active cases and 64 active cases inside the institution. And I believe for our understanding, those numbers are reported separately. I cannot report reliably on any crossover between the numbers if there's double counting, whatever. So that's the numbers I have right now. And I think that's the gist of it.
Thank you, Greg. Jay, go ahead first. You're muted again.
You
There
think
you
I'm
go.
hang of this by now?
You're good.
Just to clarify again, as far as we know, staff who work at the penitentiary and live in Drumheller proper would be counted in the first number, but inmates would be an entirely separate number, and that's the 65 you referenced, right, Greg?
That's how we read it, because the Corrections Canada site says 64 and refers to inmates.
Right. So again, I know that everyone is impatient. I'm impatient. Everyone is ready for things to reopen and be better. But I want to take this opportunity again to remind the public that just a day or two before, the number of active cases in Drumheller was 33. And now you're saying it's at 45. At the height of when it seemed to be going through this community quite quickly, we had about 60 to 70 cases. We're not far off that right now. And I think it is a completely and absolutely predictable byproduct of the most recent reopening strategies. As well as I fully appreciate the strain and stress that our local hospitality industry has faced. But if you go into a local restaurant or bar these days, you wouldn't know, aside from the servers wearing masks, necessarily that anything different, aside from fewer tables, was going on. People are re-entering their social lives in a way that I think is exacerbating the spread of this disease again. The modeling from the province said it would happen. I'm concerned that it is beginning to happen. So all we can do is ask people to buckle down, realize that yes, with vaccines going into arms, there'll be more and more opportunities for people to safely interact going forward, but it's not just yet. And that we all have to continue to do everything possible to try to limit the spread. We have had more than 300 deaths in this province for people under the age of 70, 10 in each category of between 30 and 39 and 40 and 49. This is not just a disease that takes out people age 80. And you never know who it's going to affect badly. So I just plead with our community to hang in there, continue to wash their hands, continue to wear the masks, continue to stay home when they can, and limit the amount of their cohort to what the province has recommended, because there's no other way to describe what's going on in Drumheller as a very recent uptick that's going quickly in the wrong direction. I hope council will concur.
Go ahead, Tom.
Yeah, absolutely what you say, Jay. I keep saying it, we're not out of the woods yet. We got to hang on to it, because, I mean, the result could be cases go up. Guess what happens? Then you have more and more things shut down. So I want to avoid that like crazy, and we can if we work at it. One thing I was going to ask Greg, concerning vaccinations, are you aware of, or is there any possibility that you know of finding out when vaccinations might be available at some of our pharmacies?
There are details coming out. I can certainly look into it further, Mr. Zarisky, but the AstraZeneca phase 2 starts day after tomorrow. Albertans born in 57 or earlier, and there is a list of pharmacies and locations on the AHS site. But I can certainly look into it and get back to you with more detail.
Forgive me, Your Worship, if I can. Do we have it confirmed from our Alberta Health colleagues that the Drumheller Health Center is a site for ongoing inoculations?
Yes, it is, Councillor. There, it is one of the locations for sure. So
Excellent. Thank you. That's the question I get most often is, will I have to travel when it's my turn to get a vaccine? And I know that in the past that the Drumheller Health Center has been providing inoculations. So I was hoping that was continuing. Thank you.
Christine, go ahead.
Maybe more of a Daryl question along that same vein. Do we know how many of the vaccine they have? I do know an elderly individual that did have to actually travel out of the town because they didn't have any when they had gone to go get their vaccine.
I don't, Christine. I think that, so one of the things that, and Greg has kind of referenced it, so the vaccine that's available the day after tomorrow has a different feeling than the other two that are currently approved. And so it's more readily available. However, some people might choose one of the other vaccines. And so if that's the case, they might need to go to someplace else. And then I think I can speak to why someone may or may had an appointment made, but then there was no vaccine when they showed up. I don't know the answer to that. So it is a question for our colleagues to ask and hopefully provide an answer to the community. So.
Okay, thank you.
Anybody else? Jay, go ahead.
Thank you, Your Worship. Yeah, I would just like to circle back on that last point, Daryl. I would like us to have a public statement for council to give to the general public at our weekly meetings as the vaccine programs roll out, to try to make sure that there's a consistent source of truth about this. My understanding is that people will not be able to choose from a menu of which vaccine they were able to get, and that the message should be made loud and clear that the best vaccine that you can take is the one you have access to, and to not wait, but to provide yourself with that protection, because even though there might be minor differences between whether or not people actually become infected, they are all incredibly effective against the worst outcomes, which of course are hospitalization, intubation, and death. All of the vaccines are incredibly strong in providing protection from those terrible outcomes. So I would really appreciate it if we could liaise with Alberta Health Services to have an update on vaccine rollouts in the community that become part of the regular announcements at council as this happens over the next 3 or 4 months.
Christine, go ahead.
Yeah, I just want to say that I completely agree with that, Jay. I too have heard that I think under 65 do not get the one that's being administered now or something. But yet again, this is just, we need the actual facts to be able to deliver that information. So yeah, totally echo that.
Anybody else? Okay, thanks, Greg, for that. Okay, so for the listening public, this we have a closed session that we're discussing information about town of Drumheller land, void disclosure harmful to business interests of a third party. So therefore, we will be going into closed session, and it's we just have this, and then we'll be done, and we won't be coming back. So wishing you all a great week, and look forward to seeing you next week. So therefore, council, could I get a motion to go into closed session? Jay, Tony, all in favor? Carried. Thank you, everybody. Have a great week, and we'll see you next week.